Hi, my name is Savina Vega, and today I will be presenting the special education topic on ADHD. So let's begin. What is ADHD? ADHD, or Attention Deficit Hyperactivity Disorder, is a common neurodevelopmental disorder of childhood. ADHD is a brain-based syndrome that regulates a set of brain functions known as executive functioning skills, such as attention, concentration, memory, organization, impulsivity, hyperactivity, and social skills, to name a few. ADHD is caused by differences in the development of brain anatomy, wiring, and runs in the family. So who has ADHD? ADHD is usually known to be first diagnosed in childhood, and it was thought to particularly affect kids, particularly boys. However, after some extensive research, it is now known that ADHD persists into adulthood. The American Academy of Pediatrics has rendered new guidelines expanding the age range from 6 to 12 to now preschoolers age 4 to high school or teenagers with ADHD diagnosis. ADHD is estimated to occur in 5% of boys and girls and 2.5% in men and women. ADHD is known to persist throughout one's lifetime as there are no cures and one cannot outgrow it. So, signs and symptoms of ADHD. The main symptoms are inattention, hyperactivity, and impulsivity. But some children may exhibit other signs and symptoms of ADHD, such as daydreaming a lot, squirming or fidgeting, having trouble taking turns, difficulty getting along with others, issues related to paying attention, and forgetting and losing things, to name a few. Other issues that can occur with ADHD are dyslexia, OCD, ODD, anxiety and depression, auditory processing disorders, and sensory processing disorders. So how is ADHD diagnosed? It can be diagnosed via extensive interview procedures, behavior and symptom rating skills, third-party observations, and obtaining a comprehensive history by a psychiatrist, a psychologist, or a psychotherapist specializing in ADHD. Healthcare professionals also use the guidelines in the DSM-5 to help diagnose ADHD. So the DSM-5 has an extensive amount of criteria for ADHD. The first being inattention. You need to have 6 or more symptoms of inattention for children up to the age of 16 or 5 or more for adolescents 17 or older. And they have to be present for 6 months. And they can include such activities as forgetfulness, easily distracted, fails to provide close attention to details, trouble organizing tasks, does not follow through on instructions, and does not seem to listen when spoken to. The second category is hyperactivity and impulsivity. Similar, you need to have 6 or more symptoms of hyperactivity, impulsivity for children up to the age of 16 or 5 or more for adolescents 17 and older, and they have to be, again, present for at least 6 months. And it includes extensive disruptiveness, inappropriateness for the person's developmental level. And it can include fidgets with hands, feet, squirms, and seat. Other signs and symptoms of hyperactivity, impulsivity can include interrupts or intrudes others, again, has trouble waiting his or her turn, blurts out answers, talks excessively, goes out on their own, acts out, unable to play or take turns, and runs about and climbs in situations. So besides having all these conditions, other conditions need to be met, such as these symptoms were present before the age of 12, and that they were taking place in 2 or more settings, such as school, work, or at home, and they were noted by friends and relatives, and that it's known to interfere and reduce the quality of social, school, or work functioning. And these symptoms cannot be explained by another mental disorder, such as mood disorder or personality disorder. So, there are 3 types of ADHD. The first being predominantly inattentive presentation. And again, the person has difficulty with providing attention to tasks, finishing tasks, organizations, and again, it's present for 6 months. The next being predominantly hyperactive, impulsive presentation. Again, fidgets a lot, talks a lot, has inability to sit still for a long period of time, jumps or climbs constantly, interrupts others, grabs things, and the person has exhibited a lot of accidents or injuries to others. And again, the symptoms must be present for 6 months, the past 6 months. And the last being combined presentation. So that includes inattentive and hyperactive impulsive presentations are equally present in the person and have been taking place for the past 6 months. So I did find some research on the CDC that they had completed a parent report on healthcare providers regarding ADHD from 2003 to 2011. So more than 1 in 10, which is 11% of U.S. school-age children, have received an ADHD diagnosis by a healthcare provider by 2011. So 6.4 million children reported by parents received a healthcare diagnosis of ADHD. So that is 1 in 5 high school boys or 1 in 11 high school girls. A history of ADHD diagnosis by a healthcare provider increased by 42% between 2003 and 2011. So in 2003, they had a diagnosis of 7.8%. 2007, 9%. And by the time 2011 rolled around, there was 11% of children diagnosed with ADHD. So on average, there was an annual increase of approximately 5% per year. For the percentage of children between the ages of 4 and 17 of taking medication for ADHD, there was a reported 28% increase between 2007 and 2011. So in 2007, 4.8 children were taking medications for ADHD. And in 2011, that number increased to 6.1%. So on average, an annual increase was approximately 7% per year with children taking medication for ADHD. And it was also noted that the severity of ADHD had increased by age or sometimes decreased by age. So when they were 8 years old, the average diagnosis was considered mild ADHD. 7 was moderate, and 5 was actually deemed the most severe. So with all this information, what do you do to treat ADHD? So the most effective ADHD treatment out there is a combination of both medication and therapy. Medication for ADHD benefits the controlling of his or her symptoms on the day they take the pills. And such medications for ADHD are known as Ritalin, Adderall, to name a few. But please note that medications for ADHD do not provide a cure. In comparison, therapy is provided by qualified mental health professionals, and they are trying to locate strengths to help build these children up with who are exhibiting ADHD. And they partake in providing them coping mechanisms with their daily problems, helping them pay better attention, and learning how to control their aggression. The psychotherapy also helps parents provide support and positive reinforcement. Some of the therapy approaches utilized by these mental health providers are behavioral therapy, talk therapy, social skills training, family therapy, and individual therapy, which can help build their self-image better. Some typical challenges for students with ADHD are including disruption of sleep and appetite, difficulty sustaining attention, impulsive behavior, experiencing isolation or exclusion from peers, problems with transitions, and organizational problems, to name a few. So, with that being said, there is such a thing as a Section 504 plan, which is a federal civil rights statute that says schools cannot discriminate a child with disabilities. So a student is eligible for Section 504 if it's noted that a physical or mental condition has substantially limits a major life activity, such as learning, reading, concentration, thinking, communicating with others, and activities such as walking, talking, breathing, to name a few. So if a child is determined to be eligible under a 504, the school must provide and develop a Section 504 plan that provides a child with an equal opportunity to succeed based on a child's individual needs when compared to same age non-disabled peers. So examples of accommodations that can be included in the Section 504 plan are reducing the number of homework problems, creating a communication notebook, meeting with the school counselors on academic and behavioral problems, using positive behavioral intervention techniques, such as positive reinforcements, giving tests in a quiet place, and using audio recordings and devices to provide students with notes. As a school counselor, our role is to enhance the academic performance of students with ADHD, which often involves consultation with teachers around classroom interventions, providing support and education to parents. And this can be done again through providing coping skills, social skills, and self-monitoring skills via individual counseling, group counseling, and classroom guidance modules. For teachers, some tips to help and to be mindful of is to learn about ADHD. Figure out what specific things are hard for the student. Work together with the student's parents. Make sure directions are given by step. Show the student how the assignment book and the daily schedule should operate. And post rules, schedules, and assignments. There are a wealth of resources for ADHD online, such as CHADD, Children and Adults with Attention Deficit Hyperactivity Disorder, National Resource Center on ADHD, and Attention Deficit Disorder or Association. In the attachments, I have also included some information that can be beneficial to your future use as counselors in student affairs, such as a checklist of symptoms for ADHD, tips for parents dealing with ADHD children, and ways to help students with ADHD. So I do hope this presentation provided you with additional information or insight on ADHD, the signs and symptoms, diagnosis, treatments, role as a counselor, Section 504, and resources that are available to help aid students and parents, teachers, as well as counselors to working towards positive reinforcement with children with ADHD. I thank you for your time. Have a good evening.